and welcome to this Science Saves video. I'm Gemma and I'm currently in my fourth and final year of a physics masters at the University of Birmingham, hoping to pursue a career in medical physics. Science Saves exists to raise the profile of healthcare science and its associated careers. There's more to healthcare than just doctors and nurses. We're releasing these interviews to help provide information to those considering a career in healthcare science. In this video, we'll be asking a question to a number of healthcare science staff. The question for this video is, what qualities make a good applicant to a healthcare science training position?
I would say being organised, because you're likely to have a lot of tasks and responsibilities, and also being attentive because you are working in a sensitive environment and to an extent you do have some responsibility over a patient's health and well-being. Also being quite a people-oriented person and having a strong interest in science and keen to learn new things because there are a lot of skills and knowledge to be picked up.
Well, I suppose looking back, if you've got a scientific background, a mathematical background, an inquisitive background, diligent, hardworking, empathetic, I think all of these qualities go to producing good healthcare scientists.
The ability to manage workload and juggle multiple priorities. With the SCP, you have to balance studying for your masters, clinical work, and also writing up your competencies. So good time management is key. Also communicational skills, so the ability to take complex concepts and explain it in a way that's understandable and also meaningful to different people. And critical thinking, so looking at evidence and evaluating whether it's valid, relevant, what's good about it, what could be done better.
Scientists are great problem solvers and they're really curious about the world around them. So to be a good candidate for this position, you should have interest in healthcare and in science. You should also be passionate about helping others and be okay to work in an environment where there might be really sick people around you. And finally, you should have qualities of a good leader, always asking yourself, how can we improve the way we work and care for patients? Be supportive to your colleagues and to patients. Be honest and truthful, and help people around you to get the best out of themselves.
Hardworking, confident, logical, enjoys working in a team, caring, analytically minded.
There are lots of different qualities that make a good healthcare scientist, in my opinion. Personally, I think applicants should have core values in line with that of the NHS, which include providing patient-focused care, being keen to see, embrace and create change for the better for both patients and colleagues, be compassionate and also being able to treat everyone with respect and dignity. But outside of these values, I would say that the qualities of a good applicant would include somebody who is kind, someone who can communicate with both scientists and people without a science background, so the patient and the public, good time management skills, and also somebody who has the capacity to learn and train.
So experience, I think, is a really, really strong attribute to an applicant's position. It shows that you've gone out there and sought kind of experience, and it means that from that experience you then wanted to continue applying. So I think it shows good initiative as well. And it doesn't necessarily have to be a whole placement there that you did. So perhaps more suitable or applicable in non-COVID times, but I know there's a lot of host departments that are quite happy to host students for short bouts of work experience. So that could be anywhere from a few days to a week or more, and I think you can just get in touch with these departments and you've nothing to lose really, so you can get in touch with a local department perhaps and ask if they'd be willing to host you for some work experience, and that will really bolster your application.
It's a very good question. I'll start with quite a solid background knowledge of physiology if you're cardiac or vascular or respiratory. So good background core knowledge of human physiology, as well as knowledge of what's going on in the specialism, as I said previously. You really need to explore the ins and outs of what's involved with your particular specialism. That really helps you when you get to interview and writing your application. It demonstrates that you know what you're talking about and you're ready for a career in healthcare science. Secondly, I would say that it's very important to have a critical mind and the ability to solve problems. Obviously, scientists are critical in nature. They need to review papers and scientific literature and make sure that what they're reading is true, and if not, what were the limitations with that. And really, problem solving is essential because healthcare scientists are at the forefront of innovation, and we are effectively here to solve problems, to come up with new ideas, to do imaging or assess patients or help patient pathways and that kind of thing. So really, it's a nice blend of the two. I'd say finally, you need a little bit of resilience for the scientist training program. It's quite a lot of work and quite a lot of knowledge that you have to accrue over a short space of time. But really, if you have a passion for learning and a passion for the subject that you're applying for, really you'll have a great time, and I'd really encourage an application to the scientist training program.
Thanks to all the healthcare staff who participated in this video. Some key qualities that were highlighted in these interviews were organisation, good problem-solving skills, and being hardworking. Also, having a passion for both science and helping others is very important. If you like this video, please subscribe to the Science Saves YouTube channel and follow us on Twitter and Facebook @SciSaves for more content like this. Thank you for watching.